I really like sitting and talking with people and hearing their stories. A really important part of my job is empowering people to make decisions. Genetics is really the way of the future, and I don't want our community to be left behind.
What if a single conversation could help you understand your health risks, uncover your family health history, or even shape your future? That's the power of genetic counselling. But many people don't know where to begin, so we sat down with an expert to answer the 5 most common questions you need to know.
Hi, my name is Bethany Wadling. I'm a proud Wamuli Darug woman and I work as a genetic counsellor.
Let's start with, what is a genetic counsellor?
So genetic counsellors are healthcare professionals that help people understand how a particular genetic condition might affect them individually or might affect other people in their family, like their parents or their grandparents.
What can you expect at a genetic counselling appointment?
A genetic counsellor might ask you questions about your own health or other people in your family's health. They might draw a picture of your family tree to help understand how a particular condition is being passed on through the generations. We might discuss the option of genetic testing and whether that's something that you would be interested in, but it's really up to you to decide whether it's the right time for you to have any sort of testing or not.
When would you meet a genetic counsellor?
You might meet a genetic counsellor at a few different points in your journey. The first is often when a concern is raised and you're needing more information about a particular genetic condition. If genetic testing is something you decide to do, then you'll also meet the genetic counsellor at the point of results delivery. Depending on what that result is, the genetic counsellor can help put you in touch with other people who will be there to support you as your journey continues.
What do you need to think about before a genetic counselling appointment?
It's always a good idea to think about whether you might want a support person there to help you process all the information that's being presented to you. So this might be someone in your family or maybe someone from an Aboriginal medical service that you feel like you have a good connection with. I think the most important thing to know is that when you attend a genetic counselling appointment, it is just a conversation and an opportunity to gather more information about a particular genetic condition that we might be discussing. Sometimes it's a good idea to write down some questions before you attend the appointment so that you know what to ask, and also as the conversation continues you should feel like you have the opportunity to gather as much information that you need so that you can make a decision that suits you.
What is informed consent?
Informed consent is a really important part of genetic counselling, and you should feel like after an appointment you have all the information you need to provide that consent for testing or for research. It's also really important to know that you can take back that consent at any time and that you have the power to do so.